Hello, my name is Gilly Bond and I am a specialist physiotherapist. Yes, I am a pelvic health physio. Today we are going to talk about bladder retraining. So, you can train your bladder. If you are always going to the toilet, if you're the kind of person that can't get through a film as you're back and forward to the toilet, then this is the video for you. The bladder can become irritable for many different reasons. So first off, it's really important that you see a medical professional. So talk to your GP, your general practitioner, talk to your urologist, your doctor, whoever you would normally see, but mention it to someone and get properly checked out. In the vast majority of cases, it's just a very routine, normal process that occurs for lots of different reasons, one of which being as our estrogen level changes as we go through the menopause. But in some cases it isn't, so always get it checked out first. Okay, so you've got a bit of an irritable, possibly overactive bladder and you want to change it. The first thing that you're going to do is some bladder retraining. And to begin with, it's worth doing a little chart. Every time that you go to the toilet, you're going to measure how much you're producing, how much urine you're producing. Now, a normal wee is between about 200 to 300 millilitres. And in the morning, you might be producing 600 or 500 or possibly a bit more. But quite often when people have got very overactive pelvic floors, very overactive bladders, they will be producing something like 50 mils or 25 mils or 100 mils. And once you've got a pattern and you've seen every time that you've gone to the toilet how much you've produced, you can work out when you're going and when you could have actually left it and grouped those wees together and had them at one time. Sometimes when you get an overactive bladder, you're also weeing quite a lot at night, and there's lots of different reasons for that, and again it's worth getting checked out. It's nothing terrible, but it's worth getting checked out because there are medications that can help with that, or it could just be the quality of your sleep, and working on the reasons why you're not sleeping can be really helpful. So you're going to make that chart of every time that you go to the toilet for a wee, how much you're passing, and then you're also going to measure how much you're taking in. Now, different jugs, obviously, but get a crappy jug for the toilet, something from the pound shop. But then in the kitchen, measure your mug that you would always drink from or your glass and measure how much is going in. And we want to be having up to about 2 litres if you're healthy, you're not in heart failure, and you haven't got any kidney issues specifically. So if you've been told otherwise, please stick to those guidance regarding how much fluid you should be taking in. But in a general healthy population, up to about 2 litres a day for an adult is healthy. If you're getting enough fluid in and you're passing, the fluid will never balance, by the way, so don't expect the numbers to be the same, because you use water when you breathe, when you move, when your brain thinks, everything. So the numbers might be slightly out. You may produce more water than you take in, and again that depends on your system and what medical issues you may have, or what your system has been doing that day, how dehydrated you are. So we need to have a look at how much we're taking in, how much we're producing, and that's worth taking to your local pelvic health physio, who can then tell you a bit more specifically about what you're doing. But vaguely, the principles in a generalised term are that we need to be producing urine or going to the toilet about every 2 hours, up to about 6 to 8 times a day. If you're over the age of 65, it's normal to go once at night, and if you're under the age of 65, you aren't allowed to go at night. Your bladder should be able to stretch. And if that isn't happening, or you're producing a lot more urine and a lot more voids, as we call them, so going to the toilet, than I've just said, then we need to think about training this bladder. Okay, so having gone through all of that, having got some help, having got some guidance, what we're going to do is we're going to think about every time that we go to the toilet, trying to leave it a little bit. Now, it's really hard if you're at home and you know that there's a toilet there and you're trying to hang on, but you know there's a toilet there. The best thing is to try and distract yourself. Do something else. Put the washing away. Clean something. Avoid running water. Avoid triggers. You can also try sitting down on a hard surface, crossing your legs. You can also try pelvic floor exercises, because we know that when the pelvic floor contracts, the bladder has to relax. When the bladder contracts, the pelvic floor relaxes. It's a bit of a synergistic activity, a bit of a reflex action. So if you really desperately need a wee and you went half an hour ago, then sit down on something hard, pull in that back passage as if to stop from breaking wind, or think about your pubic bone and your coccyx bone being pulled together and your back passage coming up and forward. Remember, the back passage is key, or posterior pelvic floor is also key to working when we're trying to sort your bladder out, because it's not about pulling in at the front. Have a watch of the what is the pelvic floor and how do I do my pelvic floor exercise videos. So you're getting the urge to go, you're desperate, but you only went half an hour ago. You're going to sit down, pull in your back passage, cross your legs, do something else, maybe rise up and down on your toes. And that's a very clever little thing you can do. It uses our one of our sacral nerve reflexes, but that can be helpful. But distract yourself. The more het up you get about it, the more cortisol and adrenaline of the, really need the toilet, the more that you're actually going to get that bladder to be angry, squeezy, and irritable, and try and force some fluid out. So you need to kind of go, oh, okay, yeah, all right, let me put some washing away, let me do some folding, and try and calm down. Then, if you can hold off 5 or 10 minutes, you're doing great. But aim just for 5 minutes extra each time and build it up. And it might be that this week you're aiming to go every 40 minutes. And then next week you aim for every 50 minutes or every hour if you're getting there, which is great. But maintaining the right fluid intake while you're doing that is important. So it's no good going to the toilet once every 4 hours and drinking 1 cup of tea a day. Not helpful. So we're going to train this bladder to go every 2 hours, yeah, aiming for every 2 hours during the day. And I promise you, when you start to get on top of it, you just need to do it a few times and you'll find that actually it becomes easier. And then you don't have to rush getting out of the car, and you don't have to rush when you first get into the house, ready for the toilet. Doing bladder training for about 12 weeks is really well evidenced. There's been lots of research into the area showing that if you train your bladder for 12 weeks, that you can get a good reduction in your symptoms. Now this is obviously for patients that don't have bladder pain syndrome, that might be in a lot of pain when you're holding your bladder. That you need to go and look at some of my other bladder pain syndrome, interstitial cystitis videos. But certainly trying to begin with, maybe if you can get 2 or 3 minutes further into holding, is a good place to start. Okay, so top tips. If you get that trigger, sit down, pull in your back passage or pelvic floor, however you would do it normally. Calm the brain, take your mind somewhere else, avoid triggers, and gently try and space those wees out for up to 2 hours between each wee. Now, if you have gone down the pub with a friend or have had a lot of fluid for some reason, then it might be that you need a wee every half an hour twice, or it might be that you produce a lot of urine and an hour later you need to go. So be sensible about what your fluid intake has been. If in the last wee while you've actually drank a lot of fluid, then you might need to go to the toilet. That's okay. Don't be unreasonable with yourself and make yourself hold when you're quite clearly desperate for the toilet. So be sensible. The other thing to think about is what you're drinking. We know that 30% of the population, around a third of all people, are caffeine sensitive, which means that as soon as caffeine gets in their bladder, they really need the toilet. Now, most of us, me being one of them, if we drink lots of tea during the day, we'll be slightly more slightly more frequent with our toilet trips back and forth. I certainly went decaf a while ago and it's helped a lot, but it doesn't mean that we're caffeine sensitive. Okay, so having a lot of tea during the day is not necessarily a bad thing. It's only if you're having urgent episodes where you suddenly get an onset of really needing the toilet, have to run, maybe have a little bit of a wee on the way there because you don't quite make it, and that's what we call urge urinary incontinence, so urge incontinence, then looking at your caffeine intake might be useful. But again, if you take your caffeine out slowly over a period of time so you don't get all the headaches because they're horrible, and you find that taken your caffeine out, it doesn't make any difference to your urgency, then it may not be that you're super caffeine sensitive. Caffeine's one of those drugs that it's useful to have in small quantities anyway, so it might be worth getting yourself into a reduced dose of caffeine. But I would have a play with it. You know, you are the expert in your body. You know what you feel like, but play with these tips. So that's caffeine. The other things that the bladder doesn't like is fizzy stuff and alcohol. And unfortunately, that means that Prosecco is the worst thing for the bladder because it's it is physio. Caffeine. No. Prosecco is fizzy and alcohol. Okay, so that's going to be something that really sets your bladder off. Now, it may be that if you're at a wedding or a big do, you choose to have some Prosecco and know that you're going to be a bit more urgent, and that's fine. You're an adult, deal with it. And this is obviously a video for adults. We wouldn't want any kids underage drinking, but if you are If you are really suffering with your incontinence, your urge incontinence and your urgency, then really think about cutting out all fizzy stuff, cut out alcohol for a while, and stick to milky drinks and things like fruit herbal teas or squash, or just water for a while. Those are the kind of things that the bladder likes. Now, from a cranberry point of view, that's a bit of a contentious one. There is limited evidence that cranberry helps the bladder. It's one of those housewife tales that we don't really know. I think I've read so much evidence against it and so much evidence that is for it but is of poor quality that I can't tell you that it works. What I would say is that you've got to be really careful with cranberry because it does funny things because with your vitamin K levels. So if you're on warfarin or aspirin or any kind of blood thinner, talk to your doctor before you start trying to drink cranberry to make your bladder symptoms better, because that's something that we have to be careful of. If you are drinking cranberry and your doctor's happy with it, then half and half. Good Welsh saying, half and half. Half cranberry, half water. You don't need much, you need a small glass of cranberry. You don't need to be drinking a carton of it every day. It's full of sugar and lots of other stuff. Small amounts might help with the bladder. Okay, so I hope that's been helpful today. You are going to try and train your bladder, try and look at what your fluid intake is, and do this for 12 weeks and you should notice a significant difference. So it's always worth doing that fluid volume chart, as we talked about it. So how much is going in, how much is going out right at the beginning, how often you're having a wee, so you can see, and then do that again at 12 weeks and you should see a really big difference. Okay, but make sure that you do get some support from a pelvic health or a women's health physio, or at least, if not your GP as well, if you're having these symptoms and they've come on, because we just need to get everything checked out. All right, all the best. I hope this has been really useful and I'll talk to you soon.